Australian government will allow you to access your superannuation funds for medical and dental treatment in certain situations, and those situations include chronic pain. So if you've got ongoing issues with your teeth and gums that are causing you chronic pain, but they can't be treated by a public clinic, then you could be eligible for accessing your funds for dental treatment. So firstly, you would need to see your dentist to have your situation assessed. You would need to fill out a form that's provided by the Australian Taxation Office, and your dentist will help you fill this out. Your dentist will specify the condition. If they think that you would be eligible, they'll explain why you would be eligible to access your super. Your medical doctors, your GP will need to be another person who will fill out this form. There'll be a small section for you to fill out. You will need to submit that to the ATO for assessment, and these days it takes 2 to 3 weeks for the ATO to come back to you. There is another way of doing it. If you don't want to mess around with this process, there are companies out there who can do it for you. You have to pay them a small fee, which is usually in the order of $600 or $700. They will fill out all the forms for you. They will liaise with your GP and your dentist. All you have to do is to provide your information, and they will deal with the ATO on your behalf. There are different payment options. You can pay for your treatment out of pocket. If you find that it's all too much for you, you can break it up. You can spread your treatment over a period of time. Let's say you need 3 crowns. You can have 1 crown this year, you can have 1 crown next year, you can have 1 crown the following year. So you can make it manageable for you that way. You can have an implant done the same way, 1 implant at a time. An advantage with implants and root canal treatments, for instance, they can be staged. So you don't have to pay for all of it at once. You can pay for the first stage now, you can pay for the second stage in another 6 months or 5 or 8 months. So you can do it over a period of time. In a way, that's the cheapest payment plan for you. You can, once you see your dentist, once you have your treatment plan presented to you, you can talk to the dentist as to what is of immediate urgency and what is not, and then phase it like that. Now, if you still find that that's too difficult to manage and you want to spread your treatment, let's say over 2 years or 3 years, then it might be worth considering a payment plan. There are a few companies out there now that provide medical finance. They will, like any finance, there will be an interest built into it. Some of them are very cost effective and some of them can be very expensive. But it's a great way to be able to have your treatment now and pay it over an extended period of time. Typically 1, 2, 3 years, some of them can be paid out over a longer period of time.